Welcome and thank you for joining us for the third installment of our four-part Recreational Water National Webinar Series. I'm Christy Denbrock, Chief Learning Officer at MAHC, and I will be your moderator. This webinar will focus on Colorado and the work they are doing to update their state recreational aquatic regulations as they have adopted the Model Aquatic Health Code as their framework. This presentation will describe the journey and lessons learned as they implement the new regulations. We ask that you please write your questions into the chat box and we will address them at the end of this session. If you are not a MAHC member and you enjoy this session, we invite you to become one at mahc.org. Our presenter today is Mitchell Brown. Mitch is an environmental health services supervisor with Jefferson County Public Health, where he manages the water quality program. He graduated with a Bachelor's of Science in Environmental Health from Colorado State University and holds a Master's in Public Health from the University of Florida. He has extensive experience working for various agencies and companies such as Larimer County Department of Health and Environment and the URS Corporation, Clear Creek County Public and Environmental Health, and Jefferson County Public Health. With that, Mitch, do you want to go ahead and get us started?
Hi, thank you so much. That's a wonderful introduction there. And sorry, I apologize for the yellowness. We've been having some computer issues this morning, and so usually I like to think that I look better in person, but we'll just go with it today. So
I'm with you on that one, Mitch.
So thank you all so much for joining me and letting me share my story on how we are trying to get the MACH. One thing we thought we'd be further along when I provided the input to the introduction there. So we haven't quite gotten there. I just want to make that disclaimer, but it's been a process, and hopefully as you all go through looking at adopting the Model Aquatic Health Code as your framework, you can hopefully skip some of the mistakes that we've made or learn from some of the challenges and not have to have the same headaches. So with that, I'm going to go ahead and share my screen, get that set up here, and we'll get started. All right. So like I said, Jefferson County, we are located here kind of in central Colorado. And so thanks again for just go ahead and listening to what I've got to say here and letting me share my story. I'd like to start off with the background of Colorado and our pool program and how we're set up. And hopefully that kind of ties together, makes sense as to why we had some of the challenges that we had and why we had some of the solutions that we had. So this is a map of the different counties of Colorado.
Mitch, I'm going to break in. I'm not seeing your presentation.
Oh, shoot.
Can you double check you're sharing your screen?
It says I am screen sharing.
Because I'm still seeing you.
Okay.
I can see it, Christy.
Okay, then it's my problem. I've been having issues this morning. So I'm sorry to interrupt. Mitch, go right ahead.
That's okay. The screen that you should be seeing is multicolored, I guess, picture of the different counties. Is that correct?
I can see that. Yep.
Okay, thank you. So the way that Colorado is set up is we do have a state health department, and then we have 64 counties, and each county is required to have what we call local public health agency. So some of those have banded together, and so we have about 53, some of the counties have banded together, so that leaves us with about 53 plus or minus local public health agencies. So within that, not every county has a pool program, and those that do have pool programs, they vary. So again, like I said, there's some that doesn't have anything, to the other end of the spectrum where we have a robust pool program where we go out and we do routine inspections. There are some counties that do just the plan reviews of pool facilities, and then there are some that only do complaints. So if I remember last I checked, there were about a dozen counties that are local public health agencies that have pool programs. Our current Colorado pool statutes and regulations. So they stem from our Colorado revised statutes, which is 25.5 Part 800. And those were established in 1963 and they haven't changed. So that really gives us kind of the authority to have the pool program, and it lays out the very basic and minimum standards that we have to have. So one thing that our statute excludes is the safety standards. And so therefore they are omitted from regulation. And for those of you that are somewhat familiar with the Model Aquatic Health Code, or the MACH, that's what I usually call it, you'll notice that there are some parts where that kind of overlaps and that creates a little bit of an issue, and I'll get into that a little bit. So we have the statutes said that we are allowed to create our regulation. And so the state came up with theirs, and it's 5 CCR 1003-5, and that's the swimming pools and mineral bath regulation. So that is the state regulation for everybody else to adopt and use. So that was adopted in 1993, and that was last amended in 1997, about 1998-ish. We actually don't have the dates on there, so it's kind of up in the air as to the exact date. So that was about 25 years ago. And so when I talk about this with some other agencies, we kind of look back 25 years ago, believe it or not, that's when Netflix was founded. And it looks kind of interesting how far they've come along. Gas was $1.23 a gallon, which was kind of interesting. And I think with inflation, for today, that would have been about $2.25 a gallon. So a little bit different. And then the requirement to show your ID if you're under 18 to buy cigarettes, that's when that was instated. And so just kind of some things that have been around for a while, but it's just kind of fun to see that context of that. So really, our rules and regulations have been around for some time. They haven't been touched. I have that asterisk on 1997, 1998, because technically they did get amended in 2022, but for kind of the purpose of this talk, really a lot has changed since then. So with that, what that means is 25-year-old regs is we're just not keeping up with the times, if you will. A lot of us that do have the pool programs, we felt that our recreational water safety efforts were lacking. Our reg just didn't do a whole lot to address emerging or waterborne illnesses. One of the things that got Jefferson County on the train to adopt the MACH is we had Legionella outbreak, and after working with the facility, we just felt that our reg didn't really do a whole lot or allow us to do a lot to cover and enforce upon this facility to protect people from Legionella. Our current regulations kind of are oriented, at least I feel, towards the old 1950s swimming pool model of the rectangular swimming pool. Nowadays, they've gotten fancier. They've got lots of little features that are kind of just to jazz up the place a little bit. And so our regulation, if you followed them strictly, don't even allow us things like that. And I'm talking about like the zero slope entry edges or toe edges, the benches, infinity edges, water slides, all of that, or sorry, not water slides, lazy rivers, those types of water features, splash pads. Yeah, our regs wouldn't really allow for that. So a lot of issues with having outdated regs. And so that was a big driving factor for those dozen or so counties to kind of come together and say, we need to work on getting an updated regulation. Right. With that, we had some other things where counties started getting creative with how they were trying to use the regulations. And I'll be honest, I don't think all of them were quite legal. We hadn't gotten challenged on that yet, but we were doing it in a way to try to maintain public health safety, but at the same time, not be so restrictive just because we had a document that we felt, again, was not quite up to code with the current industry standards. So Summit County, for example, they were doing things, they only do plan reviews, but what they were doing is they were writing administrative reliefs from their regulations. So they couldn't do variances, but they were allowing people, if they gave them the reason how they would protect public health, they would basically allow them to not have to follow the regulations. In Jefferson County, what we were doing, and it's what some other counties were doing, is we knew that the Model Aquatic Health Code was out there, and we were referring people to follow the Model Aquatic Health Code. The thing is, we couldn't enforce it if they decided not to, so it became more of a recommendation. So those are kind of some of the things that, that we were doing to work on that and try to allow people to install the systems and build the systems that they wanted, the facilities. Our efforts, so around August 2014, is my understanding, when the first edition of the MACH came out, and June 2015 is when Colorado started picking up interest in adopting the MACH. March 2016, those efforts started, I guess we started getting those into motion. We have what's called the Colorado Directors of Environmental Health group. So that's all of the directors of the different local public health agencies getting together. That's when they said, yes, we want to go ahead and look at adopting the MACH for our pool program and updating those regulations. You'll notice that it wasn't until March 2019, we had what's called the Pool Program Managers Group that was formed to advance the adoption of the MACH. And so that's a group that I was a part of, kind of my partner in crime, who usually presents with me, co-presents with me on this. He was the one that really founded this, and then the two of us kind of grew it to include a lot of the other local public health agencies. But it was, we were given the green light basically, and we had efforts renewed by the directors of environmental health and a little bit by the state health department there. So again, because the state is the one who oversees our regulations and writes them, this is kind of where one of our problems came into be. But they basically were given the task of getting us set up to be able to rewrite the regulations. And so April 2019, that's where they started leading that movement to adopt the MACH by reference into their regulations. So again, that was that 5 CCR 1003-5 document that we use. They started the process to do that, and as anything with a reg revision, we did have a stakeholder meeting. That was July 24th, 2019. And I'll talk a little bit more about that stakeholder meeting. And then November 18th of 2020. So you can see how long it kind of took for them to kind of work through some of the items that they had. They went before their state board of health and were able to adopt the MACH by reference into the regulation. So that is where the regulation was updated. So I apologize, it was 2022 earlier. It was actually 2020 is when that regulation finally got updated, and it does say that we are allowed to use the MACH by reference. From that stakeholder meeting, some of the feedback that we've received, the State Board of Health wanted to address. And so the first thing that the Pool Program Managers Group had to do was actually create an implementation policy. So August 13th of 2021 is when that went into effect and that was adopted. So once we had that in play, we were now able to work as a group to revise our regulations. And so that's where we've been pretty much since August of 2021 is in this revision process. I want to throw out there this note of January 1st, 2022, that the city and county of Pueblo adopted MACH-based regulations. And I'll kind of explain a little bit why that gets called out here in this timeline. And so where we are in 2023, we were hopefully trying to get a draft ready for distribution to the local public health agencies for comment. We've had some delays, and we've got CDPHE, the state health department, involved again. So some of the hurdles along the way that we've had, so as you can see, it's been a long journey. If you want to look back to maybe 2015 is when we started the process. And we, like I said earlier, we still don't have the Model Aquatic Health Code adopted yet into regulation, but it's been a long going process. So I broke up kind of some of those challenges that we had, call them the hurdles along the way, and broke them up into 4 different sections. So the first one being a legal issue. The way that the Colorado revised statutes were written was that as any city, town, or city and county may, by ordinance, regulate swimming areas. And so the way that our structures work, and I think 2008, we revised everything. Everybody had to have a local public health agency. So if you'll notice that local public health agencies, as I mentioned earlier, was county. So we do have a couple city and counties. And so that's the way that was read, cities and towns. are able to regulate, but they usually put all of that enforcement and that regulation back to the local public health agency. So we kind of got in that gray area of are we really even allowed to regulate the swimming facilities? The other part of that statute, it said the Department of Public Health and Environment, which means the state health department is the one that may adopt rules and regulations. So we were stuck waiting for the state health department to decide that they wanted to update the regulations. And then we also had some omissions from the state statutes, like I was mentioning earlier, the safety aspects of it. And then when the state did last touch the regulations back in 1987, they removed things like the theoretical peak occupancy. So we didn't even have that in the regulations. I think it was an accident that got omitted, but there were some things where our regs just didn't make sense. So to be honest, with legal stuff, there just wasn't a lot we could do. We were kind of stuck with what we had to work with. And so that was a big driving factor is why we wanted the regulation changed with the state. So I mentioned earlier, a lot of the counties got creative. We had some doing those administrative reliefs. We had some doing the recommendations. Again, we couldn't do the variances because they weren't written into the regulations. So the Attorney General's office for the state had said that we weren't allowed to hold hearings or even allow for that. Our big win for this was when 5 CCR 1003-5 was revised. And so to clarify and to allow us to use the MAC, this is the new part that got added, which was any city, town, a city and county, or a county or district board of public health. So now all of those that do regulate aquatic facilities or want to regulate those are pretty much all of those different types of entities that would be part of the local public health agency. And then it says here that we may voluntarily choose to adopt the Model Aquatic Health Code. So that language there was great, but it also comes with its own sets of challenges. The other hurdle along the way we had were resources. So if you recall on that timeline, March 2016 is when we started wanting to do started to make our efforts to adopt the Model Aquatic Health Code. But at that same time, 2015 to about 2017, the state of Colorado decided that they were going to actually work on adopting the FDA food code. So the state of Colorado had their own food code that was based off of the FDA. So instead of just using ours and having our own version, they decided let's just use what the FDA has. The other thing that we had was the what we call Regulation 43 adopted. And so prior to Regulation 43, which was first adopted in 2013, and then it was also revised and adopted again in 2017. This is for the on-site wastewater treatment system. And so their model and their framework was a little bit different and how they were set up. And it's actually the same with the childcare regulations as well. So those two are actually state of Colorado based regulations. So again, it's kind of like the retail food regulations we had before the FDA came in. State of Colorado made up their own. But what they did is then in turn, the local public health agencies have to turn around and adopt those regulations that they choose. Where this comes in with resources is the state department or the division that oversees the retail food regulation group, the child care group, is what's called Department of Environmental Health and Sustainability. So their resources went from working basically from what they do normally to focusing on the food code. So what they did, if I remember correctly, they actually have the pool program under the Water Quality Control Commission, who is also with the state. So it's a different group, but they oversee the water program. So that's where that Reg 43, that Regulation 43 falls. So both groups were working on their own different sets of interests of regulations. And so that's where the resources went. Recently, they put the pool program under DEHS, which is that food group again. So that's where some other challenges have come about with that. So while the different programs were ping-ponging where the pool program got put, we finally found somewhere that it landed, but at the same time, our other resources for people then became natural disasters. So we've had our fair share of natural disasters over the last couple of years. And so for us out in Colorado, mainly it's been flooding, and mainly it's also been wildfires. So a lot of that depends on, with again, the people that normally oversee the pool programs for these different local public health agencies would be having to respond to help out with the natural disasters when it comes to water quality, with the septics, with wells and water quality, or for those facilities that are regulated under like the food program, the child cares that were damaged or destroyed by wildfires or floods. And then 2020 was a weird year for us. And, 2020 to 2022, really, we were still all dealing with the pandemic. And so a lot of our public health resources went to having to start with that initially. And then like everybody else, I know a lot of our agencies were hit hard with the Great Resignation. And so keeping trained staff who was able to have that knowledge to provide to the reg revision process and even just to maintain these programs. And then we had the LPHA involvement. So with that, what happened is, like I said, a lot of the turnover of staff, and then the different groups. So if we go back to that there's various numbers of local public health agencies that there are in the state of Colorado, each having a different level of involvement with a pool program. That meant they had a different desire to have pool regulations adopted. So it left us across the board as well with commitment. So that's where we had a lot of resource issues there. So the lessons learned on that for resources, it is what it is, you get what you can. But the biggest thing that I would say for us that we helped us get through this is determining the priorities. And so that pool program managers group, when it got formed in 2019, we had enough agencies that banded together that said, yes, we're willing to come together and put our resources into helping revise the regulations so that we can get out of this continual problem that we all keep having with the outdatedness of the regulations. For us, a lot of that too was identifying the why. And when you talk to the different, I guess for helping us determine those priorities was identifying the why. And so a lot of I guess I would say about half, it felt like, of the agencies that came together that said we want to help revise the regulations. Half of them were because of the emerging and again, the waterborne illnesses that we were encountering and dealing with. The other half said, we were just done with having to deal with outdated regulations. We're having all of these issues with people building new pools and just the regulations that don't address that. So with that, we were able to get some dedicated staff. And so we've been trying really hard to go into it with a planning mindset of trying to create the timeline so people can understand what that resource time is going to be, and then stick to that so that they're able to say, yes, I can contribute some time and efforts to this. But from the timeline, and you can see, so if we started this in 2019, our MAC adoption, it wasn't initially the priority for a lot of people. We still don't have that. So you can see it's not the highest priority for a lot of people, but it's dragging on. And as time drags on with this, I will just caution, it takes more resources to get these done. And so as more and more resources are being needed, we start losing more and more people, which also starts to delay things a little bit longer. I mentioned earlier that the city and county of Pueblo had adopted their own version based on the MAC. And so one of the things I do want to say was kind of a success story for them and why it was a lesson learned. So they were able to get a grant from the CEC and made that their priority and made that their focus. So they did dedicate staff to working on the Model Aquatic Health Code. And my understanding, that's what they did for a couple of months, was mostly focusing on looking at the Model Aquatic Health Code and rewriting it to where it fits them, or making sure that, I guess I should say, it was written to fit them. They had to make a few changes here and there, but for the most part, they were able to take that Model Aquatic Health Code and get it pushed through. They had their stakeholder meetings. They came up with their grant deliverables and processes that they had to follow. And And so being able to adopt the Model Aquatic Health Plan on kind of an timeline. So I do want to put a little bit of a plug in and a shout out for them because they will be presenting at the NEHA conference this year on their efforts, what their grant was, what they set out to do, and what they've accomplished and their success. So a little bit of a shout out to them. Oops. The next thing that we had for our hurdle was opposition, and that's stakeholder input. And so whenever you go to revise a regulation, you obviously do need to have stakeholder input. And so I mentioned that July 24th meeting where we had it, and we had all the different stakeholders. Mostly we had were the different entities that would be regulated by us. Of course, there are, if you're aware of this, there are different regulations also out there that do pertain to the swimming pools. And so the big one being the ICC, the International Code Council, who and the Pool Hot Tub Alliance, who kind of work together, and they have what's called the ISPSC, and I believe it's the International Swimming Pool and Spa Code. So for some of you that have already gone through this, you may have already dealt with this. I've heard anecdotally that there's other states where this has happened, but the ICC and the PHTA want the ISPSC adopted as the base code for swimming pools, being that their reasoning is a lot of this have to do with the building department, and a lot of the building departments out there follow the ICC. So that meeting that we had on July 24th, if you've ever watched the Muppets, I feel like we kind of have the two older guys in the balcony that always have their input. I feel like our meeting kind of went that way, where we had everybody on board. It sounded like there was very positive energy, like, yes, this is good, let's do this, let's go. Toward the very end of it, we're about wrapping up. We had one individual then that gave their very opinionated, strong opinion, I guess I should say, thoughts on the Model Aquatic Health Code, being that they did not feel that the Model Aquatic Health Code was peer reviewed. They did not believe that it was the right code. It was a bunch of hooey, to kind of put it nicely. And so with that, the dominoes started falling, and why I say I was kind of like the older gentleman from the Muppets, because it started out like, yeah, that's great, let's go, that's good, to also like, well, hold on a second, maybe it's not that great, to, you know what, I don't think this is a good idea, let's not do this, we don't want new regulations, we don't want the MACH at all. So we had to do a lot of kind of PR, press, pushing for that, and trying to get out there and sell the Model Aquatic Health Code. If you call back again, with all the different various health departments out there, with the different varying levels, even within our own groups, we had opposition and regulatory opposition. So if you can imagine, if we can't even be internally consistent and on board, then externally, there are people that saw that, and that also created some issues. So the need for everybody to kind of be on board, everybody kind of wanting to see the same vision and moving forward with, for us, the end goal of being the Model Aquatic Health Code as our framework for updated regulations. That was the biggest challenge that we kind of had, was getting everybody onto that. So the lessons learned for that and how we did that was the stakeholder feedback. The communication was the biggest piece that we had, and the biggest piece that's difficult is communication as well. So for those of you that are regulators, you know how this goes, where we have our regulations, we have our thoughts, we have what we know or what we feel is best for public health. And so it's trying to get other people to buy into that behavior change, that understanding of why we're doing what we're doing, that we're not just being regulators just to come down on small businesses, trying to make people's life hard. So we had to do a lot of outreach with throughout the state, really, and with a lot of the entities that we had. And so again, being fragmented as we were, because we're not one state health department run program, and it's an optional program, the locals had to really go work with their entities, their building departments, and all of that. So that was us trying to address the impact. At the same time, I mentioned earlier that we had the the implementation policy that was required by us to, by the State Board of Health, to basically go out and say, as we work on the Model Aquatic Health Code, this is what we're going to do to ensure fair and consistency. So with that, we had to work on the regulators also being unified. And so together, that's where that pool program managers group, we didn't have anything signed or anything like that, but we all did come together to agree that yes, what we will do is we will try to create one format, one framework of regulations that we all can try to work off of. And so the feedback again with some of the stakeholders, aside from which code to use, was, we just want to know what we have to follow in the end. And so a lot of places that have facilities in multiple jurisdictions, they did not want one facility being treated differently or under different regulations than the other. So they wanted them as consistent as possible. So that was the hurdle that we had. So that was kind of the decision making on that one. And so, like I said, the pool program managers group, and there's about a dozen different local public health agencies that were part of that. So the hurdle that we had was no clear guidance. And that kind of stems from what I'm going to say is the state support. So if anybody from CDPHE is listening, I'm not trying to bash on you guys. I'm just trying to state here what the history that we had was. Initially, we had a letter from the state health department that said, we will not be involved with any of the reg revisions. We will not do any enforcement. We will not do any of that. What we will do is, because we are responsible for writing the regulations, we will get you a revised version that allows those that want to adopt the Model Aquatic Health Code into code. So that's where that 2020 revision came into play. The one that I read earlier that says the different local public health agencies, if they voluntarily choose to do so, may adopt the Model Aquatic Health Code. So that was where now you've got 12 agencies coming together, trying to run the efforts to agree together to create one document. So with that, again, the decision making with different levels of involvement, there's different levels of desires for pool programs, and so different levels of interest. And so that also came into play. You've got some people that wanted really robust programs, and then you've also got programs that are, some people, I would say, some agencies that don't have pool programs, and so they didn't want there to be a lot of involvement. So we had to try to find the happy medium with that, and where that would lie. So the state, what they had come up with, again, those that wanted those robust programs can go ahead and adopt the Model Aquatic Health Code, but just know at the same time, we have it written in that we are keeping our current regulations as is. So now, right off the bat, we have at least 2 sets of regulations. And so if you think about this going back to the complaint, we want consistent regulations. So that was kind of our objective, the pool program managers group coming together. But they didn't want 64 different sets of regulations out there. That kind of ties into format. So what was the format going to be? So like I mentioned earlier, we have the current Colorado code. It doesn't look anything like the Model Aquatic Health Code. It is kind of set up in paragraphs. It says, basically, this is how you're going to follow the design, for example. It puts everything into a paragraph and just kind of lumps it together, leaves it kind of vague. Whereas the Model Aquatic Health Code has it broken out very specific, and in a way, in my opinion, each item is labeled out, and it helps if you're trying to cite something or where you're trying to say, instead of having to read a whole paragraph to find what you're trying to say, it's very clearly spelled out in the MACH. So that was the debate that we also had, again, with not a lot of clear guidance as to what you want. You've got 12 people, we want to set this up. And so Pueblo, they, after this group worked on agreeing on a format, they broke away and said, we're going to go with adopting just the version that looks like the MACH for their reasons that they had because of the grant. The other thing I come up with, the format, different levels of involvement, all that state support. So our current regulations is about 31 pages. And if you looked at the Model Aquatic Health Code, it's about 200 pages. And so that was a huge thing as to how do we try to make that where everybody's okay with that, because it's going to be a huge change of to somebody's program. And so that's why we had a lot of decision making, or I guess indifference, and how that gets decided. So the lessons learned kind of seems obvious, and it's kind of one of the duh things with clear leadership. But I tried to think about outside of Colorado what that looks like. So I did talk with some the people that helped spearhead the Model Aquatic Health Code adoption for the state of New Mexico. They gave me a presentation that they provided when they did their, and so I got to talk with some of their people a little bit through the years. But my understanding from some of the other places is there is this issue where maybe the city might adopt, but then the county might not adopt. And so you get into this whole realm again of maybe you have this fragmentation. And so for us, the goal was to have consistent regulations. So for me, and the issues that we felt that we faced was we needed clear leadership. So again, back to the state, what we would have preferred is the state has said, here's the regulation that you're going to work off of. Again, we had the 5 CCR 1003-5. It got revised, but it just only got revised to really include the language for local public health agencies to adopt the MACH. And then they left it where there was potential for two major versions, the one that looks like the MACH and one that looks like the current regulations, which is why also the other thing that we want is the common regulations. So if you recall, when I talked about there's the method of the state going through and saying, we have the Colorado-based regulations, it's based off of the FDA food code. Forget trying to write regulations on our own. Let's just adopt the FDA food code. But then at the same time, we have regulation 43, which is Colorado based. It's written by Colorado for Colorado, and each county has to adopt it. So that was I guess another formatting issue that we had, is which one do we go with? And so once we kind of have that down, if you can make that decision, you can come up with common regulations. Everybody kind of works from the same book. That was our goal, and that would be my recommendation. My advice, if you're trying to do this, is anybody that would be involved with these, you don't want several different sets of regulations to have to work from. So different models, different ways of looking at this. I can't say that there is one that is perfect. So that's also what makes it also hard to come up with that, but that's where I feel that clear leadership comes into play. The other thing that I have is some considerations that we still have to kind of work our way through. And I just want to throw this out there. So anybody that's looking at adopting the Model Aquatic Health Code, some other things that you're looking at is the enforcement timeline. So like I mentioned, our current regulations is 31 pages. It's going to be 100 or almost 200 pages if we adopt the MACH in full. There are some items in there that step up from the amount of requirements that are on pools right now, and they're going to need some time to comply with that. There are going to be some issues with funding, and there's going to be issues with availability and the desire. So City and County of Pueblo did a great job, in my opinion, of trying to address some of that. So this is their grant. I don't want to steal a lot of their thunder from their presentation at NEHA, but they did some creative things to where they were basically trying to help people come in compliance with that timeline. The other thing is the MACH does write, and it's in the MACH, I should say, a timeline of 1 year for some requirements. So that is something that if places don't have those already in place and don't have the ability to come into play or come into compliance, having to keep those things in mind. What are the considerations for us and those local public health agencies are we going to do to work with people to ensure that we're being fair, but we're getting, for us at least, the advancement in pool regulations and pool safety. The other thing is consider for us is going to be documentation. So right now, with us being fragmented, every agency having its own set of plan applications, documentation, inspection forms, stuff like that. Trying to come together, create one set of that. So it's a statewide type looking, similar looking set of documentation. Training is going to be the other thing to consider. Right now, I'm not sure how many people are gurus in the Model Aquatic Health Code. So like I mentioned, my partner in crime that works for Summit County, I would consider him more my Model Aquatic Health Code guru. I've got one person on staff who comes from the state of Florida and has got some familiarity with a version of the Model Aquatic Health Code. So those are the two people I rely on the most. But if we're trying to roll this out statewide, we're going to have to learn, teach everybody else that's trying to learn the Model Aquatic Health Code, how it applies to them, how they interpret it, how they're going to be able to enforce it within their jurisdictions. Then the other thing that we have is in the state of Colorado, so our current regulations is for swimming pools and mineral baths is the name of the title of the current regulations that we do have. So we do have lots of hot springs, which presents its own set of challenges. The hot springs that we have out there, there's two types. There are some that are looking like your normal swimming pools, but they use the water from a hot spring. So that messes with the chemistry a lot. And so it's how do we apply from what's in the MACH to the hot springs. The other thing about hot springs is then they're kind of like natural swimming areas where we have flow through or one pass systems where basically they take they will collect it in pools and then it just flows out. And so the Model Aquatic Health Code doesn't really set up to address that. So it's this weird kind of in between type specialty set of facilities that I think that need to be regulated. And how do we do that? For us, hot springs, kind of looking at them a little bit like flotation tanks, which are in the Model Aquatic Health Code. There's some science that support they're not as much of a health risk, but then there's also some issues if we get into safety, but we want to make sure that we're being also ensuring the public health of the users of these facilities. The last one that we have, the natural swimming areas. I know we're not alone in the lakes, the beaches, and those are areas that, again, it's kind of like a swimming, or it's kind of like a pool in a sense that you have a lot of people swimming in that, but it doesn't get disinfected. They can't add disinfection to it. And so we're fortunate enough being Colorado, we're still cool enough. We don't have the issues with like Naegleria fowleri, but we are starting to see issues with harmful algal blooms coming to our state. And so it's something that we're starting to take on. So again, our current regulations, the only thing that we're looking at for natural swimming areas and in terms of enforcement and public health risk is there too much E. coli in the water? And so as we look at some of those emerging waterborne illnesses and issues, that's what we're hoping to upgrade or update as well in our regulations. So those are some of the things why we haven't made a lot of progress yet, just aside from trying to herd the cats and do one consistent document that everybody can kind of agree upon, and then trying to take on the rest of the issues that the state is facing together. So with that, I do owe a lot of kudos to some people. And so Steve Procyse from Summit County, that was the person who is my partner in crime. Tara and Shawnette are from the city and county of Denver. So they're under home rule, so they can kind of create their own regulations. So they were the ones that have basically spearheaded creating a draft regulation for a format for us that we were able to kind of work off of, and we started working off of. That looked a lot like the current regulation, but has items from the Model Aquatic Health Code adopted into it. Then we have Autumn, Megan, and Scott from the city and county of Pueblo, who are on the other end of that, because now we're stuck between the two different formats. So they're the ones that did all the work to create the MACH-based format. And so both city and county of Denver and Pueblo have been fortunate, have been so gracious enough to let us basically copy their homework kind of thing. And then Levi Cole and Eugene Knight are the two from New Mexico that have provided me some support and provided me with insight of the process that they went through in order to get their Model Aquatic Health Code or their regulations adopted with the Model Aquatic Health Code. And then the directors of environmental health and the pool program manager. So there's a lot more people that were there. And so those are those people in that group that I just want to thank. So They bring up CDEH and the state. Sorry, I forgot. I do need to go back. One of the things that was with unified regulators and why we've actually had some of this issue is the state originally and initially said, nope, we're not going to do any enforcement. We're not going to be involved with the regulations writing. We're just going to get you that paragraph that allows the local public health agencies to adopt the MAC by reference. So what they did is they basically were hands off. And as we got our draft ready and done, the one that Denver had kind of put together, that version, we called it the Denver version because that's what it was based off of and looked like, that their format there. State came back and said, actually, we've done some reorganization. We're going to have somebody assist you with writing the regulations now. And so that was earlier this year. So just as we're getting ready to put a draft out to the different local public health agencies of that pool program managers group, state kind of came in and said, yeah, we'll help you, let's get caught up. And so as we're catching them up on the process and where we've been, we've had a lot of questions coming, and then they started becoming our liaison to the Attorney General's office. And we were basically going one direction, and this discussions with the state, now we've kind of almost done a 180 back to, well, based on our discussions and what we think, we should really do it this way. So that's where now we're looking at that Pueblo format. So we thought we had a version and a document ready to go out, and then we had this kind of last minute change in course. And so it wasn't an intentional course direction, but it was one of those things where we were asking for that guidance, that leadership, that state support. We started getting it, and we kind of got it at the last minute. So again, I'm not trying to talk negatively about the state health department or anything like that. I'm very grateful for their efforts, and this is kind of what we're wanting all along. We just put in a lot of effort, and then they've kind of come in, later in the game. And so hopefully now what that means is we will have all of those items where the lessons learned come together. So again, that clear leadership, that common regulation, and we can go back to, because again, if you remember, the state has the one regulation, and then the locals will have to go through and adopt their own version. So we can get the state to kind of get us hopefully on track with that. So I kind of got myself a little bit out of whack there, but again, thank you to all those that have been helpful with these efforts. And so with that, here's my contact information. So if anybody is having questions about things that we've done, if I didn't make sense or something like that, I'm always more than happy to talk with people and help you all through the process. So with that, I do see there's some items in the chat, but I think Christy was going to help me moderate some questions here.
Yes, thank you, Mitch. That was a fabulous presentation. I really liked where you put the lessons learned. People always want to know what areas to avoid and how can they avoid them from somebody who has gone before them. So let me ask you, if a state is looking to do this, and of course, from your presentation, it looks like you had an incredible strategic plan, timeline that you had to stay true to, and you had to pivot a couple different times. As you said, you're going down one road, had to pivot and go down another. For a state, county who's looking at this, what would you say the very first initial step would be?
For us, and I think like you just said, is just that planning piece, that strategic plan. So if the end result is going to be the adoption of a MAC-based regulation, just getting together and doing that plan. Who's going to be involved with it, who needs to be involved. So not just at the stakeholder level, but as it's like, again, with Colorado being the local public health agencies, we all had to come together to say, what it is that we can offer to get this adopted. What is it? Because we all had the same outcome, like everything else, we just all had different means and ways of getting there, different resources to bring to the table. So if we can kind of get together, have those kickoff meetings, who can bring what, how much effort it is, I think just like I said, the communication piece of it, on the regulator side of who's going to be enforcing that, putting these regulations into place. if you can all be on the same page, it makes it a lot easier for then you to turn around and then communicate that out to those who will be regulated or who have a vested interest in the regulations revision process. And having that unified front, having the details planned out, like a timeline, how long it's going to take, you know, even if you can kind of give them an idea of what this is going to look like when this is done. You know, we know going from 31 pages to a 200-page regulation is daunting. It's scary for a lot of people. But in a sense, most of what is going to occur for the changes for them, we can kind of already give them a heads up. This is what this would look like. So secondary disinfection, for example, for high risk venues, you know, that's going to be something new for us. The types of feeders that we see for the disinfectant, the automated controllers, you know, those little things like that, the diaper changing stations, those are all things that will, you know, if they kind of know ahead of time, they can kind of plan for it. I think it helps ease that anxiety of bringing on a new regulation, and then seeing that we actually have a game plan, what we want to do, the timeline, and all of that.
So where do you go from here? What are your next steps?
So pivoting, we're trying to get basically that direction as to what format of draft regulations we'll have. So if we come down to being that we have 2 versions, you know, I think we can live with that. I think technically it can be 3, because we'll have the old version. We'll have an old version that has the Model Aquatic Health Code components added to it. And then I think we'll have a version that looks a lot more like the Model Aquatic Health Code. So if we can try to keep it to those three formats as best as possible, I think we'll call that a success. But again, what happens is we'll throw that out to the different agencies that want a pool program, because again, we have the differing levels of involvement to a pool program. And so we might lose a little bit of consistency there, but at least the base regulations and format is there.
So what would be your final words of encouragement for anyone who is starting this process?
Good luck. The process, it's like any other reg revision, and I think it can go smoothly with the planning. One of the things that I know New Mexico has stated, and the thing that we've found that we've really appreciated, is the assistance from CMAC, the Council for the Model Aquatic Health Code, the group that actually drafted the model, the MACH, and works with the CDC and stuff like that. So they've been very helpful with us. They were the ones who, at the start of this, at the stakeholder meeting, they did have a representative there. And so that would be my suggestion. I don't know if I quite touched on that, but having somebody from the CMAC at your stakeholder meetings there to help answer a lot of those questions, especially if you're not as familiar with the Model Aquatic Health Code. You know, it's a document that I've looked through a couple times. I'm just not as familiar with it because I don't spend a lot of time with it yet. So really leaning on that resource is a great, they're just a great group of people to work with. Being involved with the CMAC is another one that helps you kind of get involved with it. So you've got an idea of what you're working with. And then I think the last piece of it, for me, again, just Colorado based, is if you can just find that clear leadership. And then with that clear leadership, having that vision, having that direction, and then sticking to it. Because I think that's where we're getting a lot of those pivots, is the fact that we have a lot more people in invested interest working on that with varying levels of interest. And so it makes it very easy for somebody to come in and say, well, we don't want it as robust because XYZ, or we want it to look this way because our interest is this or that.
Well, those of us who live in Colorado, we thank you for your persistence in putting this through. And we at MAHC would like to thank Mitch for sharing his expertise and the gift of his time. We encourage you to join us on June 8th for our 4th and final installment of this recreational water webinar series, when Dr. Elizabeth Hilborn of the EPA will discuss harmful algae blooms. And your feedback to us is very important. And we encourage you to fill out the survey that you will receive, and to help us to continue our mission to build, sustain, and empower an effective environmental health workforce. We thank you for attending today. And Mitch, again, thank you. Your presentation was just fabulous. And 2 weeks ago, we had the webinar where we discussed the MAC and the CMAC and had individuals involved in that. So again, thank you everyone for attending today. We appreciate it. Mitch, you were fabulous. And we will see you again on June 8th. So thank you everyone for spending your lunch hour with us today. Thank you.
Thank you so much. My pleasure.